From sunny Southern California, we bring you Meet Bridget, a podcast for building confident communication and female badassery. We spotlight women who have bridged the gaps in their lives by building strong relationships and speaking their teenage dreams into reality.
Bring it on, baby.
What we've got here is failure to communicate.
Welcome back to Meet Bridget, Season 5. I'm Asha Gabriel, and I co-host this show alongside my best friend, Kashia Rosenberg. Our show is a giant library of career and life path options for young women to relate to by sharing the honest and unfiltered teenage stories of a diverse array of successful women. We believe that confidence starts with self-trust and grows through authentic community. Tapping back into our formative years makes this Meet Bridget community a place where women of all ages and stages can connect on common ground. Today, I am delighted for you to meet Dr. Blair Murphy-Rose, MD. Dr. Murphy-Rose is a board-certified cosmetic, medical, and surgical dermatologist, seeing patients in Orange County, California, and New York City. She is also a clinical instructor of dermatology at Cornell Hospital and the founder and CEO of the award-winning clean and hypoallergenic skincare brand, Skincare Junkie, which is now available at Nordstrom. She has been awarded as a Castle Connolly Top Doctor, a New York Super Doctor, and is a fellow of the American Academy of Dermatology, the American Society for Dermatologic Surgery, and the American Society for Laser Medicine and Surgery. Nationally recognized for her expertise in facial rejuvenation, laser procedures, and evidence-based skincare, Dr. Murphy-Rose is a go-to expert who has been featured in Vogue, Elle, Allure, and the Wall Street Journal. With her thriving clinical practice and her hypoallergenic clean skincare line, she is redefining skin health by bringing dermatologist developed science-backed solutions into everyday routines. I am so excited to have you here.
Thank
You
you.
clearly, your intro speaks for itself. You have such incredible accolades, and I think that the importance of that when someone is thinking about how to handle their skin, their face, the first impact that they can have when they walk in a room, it means a lot to have someone who has worked so hard to establish these credentials taking care of them.
Thank
So I'm
you.
so thrilled to have you on.
Great. So happy to be here. This is awesome. I love the
So
premise of it all.
yeah, thank you. Blair, Dr. Murphy-Rose. Always feel uncomfortable
No, Blair
calling
is good.
even
Blair.
like my doctor friends, because I'm a daughter of doctors. I'm like, that is years of studying, So I'm like, I'm so tempted just to always even call my first name friendships like Dr.
Doctor.
Blair, because you're just so impressive.
Oh,
There's so many places we could dive in. Most
yeah.
recently, your skincare line, Skincare Junkie, which I have tried and am obsessed with. It's literally,
Yay.
I have been having, I feel like after having kids, I'm having this like new hormonal wave of skin things going on. And I
Yeah.
swear the pore pads, the little just
Pore
pore
therapy
cleansing
pads.
pads. Yes, they are so gentle, but so effective. There they are. We're going to link your products because I think for our audience, women of all ages can relate to those moments in your life when our skin is just a little tricky and we need
Yeah.
something that's effective, but also gentle enough that it's not going to cause additional problems. And I think that
Yeah.
your line is just right in that happy place.
Yeah, well, I see it all the time in practice, quite literally every day. And patients of mine were always overusing or, using products that were causing the skincare problems they were coming to see me for and having no clue. They're
Yeah.
not coming in saying, hey, I just used this product and I have a rash from it. It's not that. It's, hey, why is my texture changed? Why am I breaking out for the first time? Why do I have this rash all over, whatever. And every time I have a patient come in, we go over the products they're using and this and that when I want to know all of their exposures, for the most part. And so often it's those products that we're using. So I wanted there to be this less frustrating solution where you get the daily skincare staples. You can go to the store and purchase skincare that is going to likely work and very unlikely to cause the problems I see every day in practice because it's frustrating. And so many of us have sensitive skin, or you don't have to have sensitive skin, you can have just normal skin that is prone to these problems that so many skincare products on the market cause.
Well, and it gets so tricky because I think at this point, most of us we care about our skin,
Hmm.
and I think the more you do that and the more we're advertised to, whether we're walking on the street looking at our phones, like there's a new product in every different direction with this new chemical. And I swear I've had moments where I've had to just open my skincare drawer. I'm like, when was the last time I used any of this
Yeah.
stuff? I don't really know what does what. What should I be doing in which order?
Yeah.
And have just wanted this need. I'm like, I can't imagine how many thousands of dollars I've spent over the years in
Yeah.
all of these skincare products that I like kind of use mishmash. And it's like, okay, at some point you just need to like get a team, like have a professional that you trust,
Yeah.
simplify this whole
Yeah.
process and clear out that skincare drawer. So I think it's so cool that you
Absolutely.
focused on this and that it's been evidence-based and results-based in your practice.
Yeah, well, it was named skincare junkie for a reason. I have so many patients, and it was happening. I've been in practice for a little over a decade, and there was a change. There was a switch that happened kind of with the advent of, Instagram and social media coming about, where there's more and more information about skincare, and patients were really more and more becoming skincare junkies, and they would come to me with their bag full of, 10, 15 products, or literally show me on their phone their list of all the products they were using. And it's like, okay, this is not, you can have fun with skincare. It's just like makeup. You can use many products and you can enjoy them, but if you're starting to notice some problems with them, we should probably pare it down and get down to the basics, which is what our line is all about.
So, I mean, you are incredibly busy in your practice seeing patients, but you also have launched this you know, skincare brand, which is its own job to manage something like that, especially if you're at the place where you're going into Nordstrom and these big retailers. How do you balance your schedule when it comes to taking on patients, structuring your day, managing a brand now, and then
Yeah,
also being a mom and all the things that you
I know.
do outside of work?
Well, it's hard. I mean, as a mom, you know that alone is a full-time job, and it, can and should be. So it's a lot. It's a juggle, but it's really that team and being able to delegate. Fine, I have my family. My husband's very helpful. We rely on many people, and then hiring the right people to help out with the skincare line. And when you're doing it as a small startup with a, excuse me, not a massive budget, you really have to find super quality, dedicated team members that are going to help, um, you know, get you there, and to be able to rely on. So it's my village.
I love it. And I think it also is important to share that it's like even in these, a brand that is clearly comes from your individual expertise, your experience in practice, but to share that it's like it is a one man show in some ways where that I'm sure you're making the decisions that lead the whole ship, but that it
Mhm.
wouldn't be possible without bringing on help to, you know, make you be in more places at once than you could
Absolutely. And it's hard to decide, where do I divide my time? How do I split it on a day-to-day basis, on a week-to-week basis? Which, I like to say everything needs more attention than it gets, which is true, but where do you put that? What's most important? Prioritize, triage, find the best way. And it's always a work in progress, and I make mistakes all the time, but as long as, you're keep going forward, keep rolling with it,
totally.
and just make sure the most important things aren't, being left behind. So for me,
Yeah.
that's my kids and my patients, my family and my patients. If that is taken care of, then the rest can fall into place, and try to get this skincare into as many hands as possible, because, I think it's life changing, and it brings people's best face forward, like you said, and in the at the start, so important to your face is the way our appearance is so key to the way we feel inside and the way we walk in the world. And so it's so important on, yeah, it's just skin. You could say, oh, it's, whatever, it's a cosmetic thing, but it's really not. And it is so important to our mental health and our psyche.
And I think there's something too, like makeup can do wonders, and we've all had those moments where like, thank God I have this cover up because I have this and this going on.
Yep.
Um, but to be able to wash off your makeup in the end of the day, or be confident enough in your skin that it's like, I mean, I don't have time many of my days when I'm running around with my kids. I'm like, I'm making a choice between doing my own makeup or like getting the lunch packed for the kid
Yep.
or prepping for a podcast interview before I leave out the door. And I'm like, usually the getting myself ready just is the thing that
Yeah.
doesn't happen. So relying on like clean, fresh
Yeah.
skin to just, throw my moisturizer on and walk out the door and just be like, yeah, this is my face.
And feel
I
good.
think it's
Yeah.
yeah, it's a great feeling when you can do that.
Yeah.
Now, there's so many different procedures, devices, new like ingredients in skincare that are constantly being thrown at us, and we're in this interesting age of social media where like I'm sure you're having patients come to you and be like, I heard about the salmon sperm facial, or I heard about this
Yep.
laser. What do you think about this? Where it's almost like, they're bringing some of their own personal research to you. How are
Yeah.
you filtering through what you want to include in your practice and um, basically making decisions about what types of services to offer?
Yeah, and it can be overwhelming, both from patients and consumers, and also on the other side, what is most important. And I base a lot of it on evidence. What is the data, and then so much of it is my experience and my colleagues' experience. I'm always talking to my co-residents, my fellow dermatologists, older, younger, getting a good understanding of what's out there. A lot of times, a lot of times there's copycats, right? There's new devices coming out that aren't that different. And so you don't need to offer everything as long as you have, if we're talking about the aesthetic side, a good arsenal to do the things that we want, whether it's treating hyperpigmentation and tattoos or boosting collagen, retexturizing the skin, fighting fine lines and wrinkles, lifting, firming. There, you don't need that many devices, decreasing redness, that sort of thing. If you have a few really great devices that work so well, you can manage so many different problems. So, there's a lot of fun new tools coming out, but just staying focused with what works and is kind of the key.
I also have noticed out on the market, especially for aesthetics, that there are providers with credentials and not so many credentials that are out there. And I wonder about the ability of people to pay attention to those things and what to look
Yeah.
for. As I mentioned in your bio, Dr. Blair is a MD. You are a medical, surgical, and aesthetic dermatologist. Can you um, maybe share with us what you've seen out on the market and what patients should be looking for when it comes to credentials of someone they're going to see for any kind of procedure?
Yeah, I mean, at the end of the day, someone who's been trained and has, is a board certified dermatologist is likely to have a very good um, breadth of knowledge and experience to get them to the point where they become a trusted expert. That said, you know, there are dermatologists that will say things that I don't agree with, and vice versa. So you can't always hang your hat on someone's credentials, but it's a good place to start for sure. When you're thinking about who to trust and what to trust, someone with no medical background may have really great skincare advice because they've tried so many things and they get their own experience and they get a sense of what would work. So if you're talking about like how to treat a skin cancer or whether to use sunscreen to prevent skin cancer, I would trust the experts because I would say every dermatologist you go to is going to have fairly similar thing to say about that. But when it comes to what's the best moisturizer for my skin, talk to somebody that very well may know, and that could be from trial and error, that could be from knowing an expert. But at the end of the day, is a board certified dermatologist likely to be a better source of information about your skin health than you know someone off the street? Yes, absolutely. So
Totally. So you are wearing multiple hats, clearly. You are a doctor and you're also now a CEO and founder of a company. Can you, if you could self-label like your main personality traits that make you successful in those roles, what would they be?
Yeah, I would say I've always been very determined. You know, if I set my mind to something, I will do whatever I have to do to get there. So that's really important. I am an eternal optimist, for good or for bad. So sure, that can have some faults when you're like, well, I'll make that flight, don't worry. Um, but as far as, kind of staying focused and not getting too down on something and being able to um, take the highs and lows and ride the waves of running a business. That always has served me well.
I love that. If you could hire, and I'm sure you do, when you hire young people to shadow you, to intern in your office, to learn from you, what are you looking for in terms of qualities for young people that might be well suited to this type of career?
As a dermatologist, let's say,
Mhm.
well, being a people person is pretty important in most fields of medicine. I mean, you can go to radiology and never see a person for after medical school, um, but being a people person helps. Having that, many of us just by nature want to help, and um, that certainly has been me since I was a child. So that's really important because being a doctor is a lot of work, and it takes, it's a lot of time and training, and then it's a lot of dedication to your patients once you're in practice. So if you're going to dedicate your life to taking care of people's health, it's important that you're passionate about that, right? It shouldn't just be, oh, I want to be a doctor because my parents want me to be a doctor, or I want to be a doctor or a lawyer because those are, the only professions that will suit my plans for myself or both. It really comes down to wanting to take care of people, because at the end of the day, that's what we're doing.
Absolutely. Did you always think that you wanted to be in a medical field, or how did that come to be?
So when I was a kid, I was always that kid that wanted to take care. I say this and like I don't know if there's other. Yes, there must be, but if like my friend got a scrape on their knee, I was not excited about it, but I really wanted to get involved and wash it and do the right thing. And who knows how I was taking care of it at that point is probably not what I would do now. But I loved that. I come from a
Yeah.
family of physicians. So my father is a cardiologist, went into medical device development early on. My mother's father, my grandfather, was a pediatric neurologist, actually
Wow.
one of the godfathers of the field in New York City, who sadly just recently passed. But so coming from a field of doctors where around the dinner table you're hearing about medicine all the time. And so those two things kind of factored into me wanting to be a doctor from a young age. But as it turned out, like years went by in high school, I gravitated, well, I guess I would say really more like in college, I was gravitating towards, I didn't know what I wanted to be at that point. It was like I could do all sorts of things, right? And you don't know. And I was going to talk about how it's interesting because you really don't know all of the jobs that are available for one. I've always said in high school there should be courses dedicated to teaching you about all of the possible things you could do because you don't learn about
Certainly.
them. Yeah, no,
Totally.
exactly. This
Well,
is so
that's what
important.
I kinda realized too, where it's like I had so many different resources and parents who wanted to love and support me and access to, a great college and stuff, and I still kinda felt like I didn't really have a understanding of just the scope, like the
Yeah,
incredible number of different career
yeah,
opportunities that were actually out there until far after I graduated college. And that's
yeah,
kind of where we were like, all right, well, let's make a resource where we can just show people like there are
yeah.
so many different paths you can
It's
take.
so smart because it wasn't for me until like applying for my first job out of college, which by the way was not in the medical field, and when you're starting to look through all excuse me, all of the different job listings, you're like, oh, I would have never known that was a job. I would have never
Yep.
known that was even a field, right? But it was my freshman year in college, going through the course catalog and deciding, what do I want to do? And I didn't know at that point. I was, being a doctor had been in the back of my mind, and by the time I got to college, I was like into sports, and I didn't know what I wanted to do at that point. But I just actually gravitated towards the class. I just took the classes that sounded interesting, and most of them fell into sort of like sociology and psychology, and I ended up being a communications major. But I had a circuitous route to ending up being a physician.
I think that's also so great for people to hear, though, that I think there's a big assumption that it's like, okay, if you want to be a doctor, you got to start young and
Yeah,
you were on that path for years and years and years. And that, like,
yeah,
if you didn't pick bio or something in early college, like, it is probably going to maybe take a few more years, be a little bit of a longer route
yeah.
to get the credentials that you need, but it's not impossible. Um, and you have done that with flying colors.
You know, when I was just driving home to come join this podcast after seeing patients, I was thinking about like, what would I want to tell someone about this, about, this
Uh-huh.
topic of um, deciding what to be or thinking about, everything that Meet Bridget stands for. And I thought one thing I would want to leave people with was that you do not have to take that direct route. Just like you said, I certainly didn't. And um, when I was in college, I always thought I had to finish 4 years of college. Then I needed a job or decide to go to grad school, and it had to be like that. But it really doesn't. I tell my nieces and nephews when they were in college, most of them have they all finished now? No, most of them have finished right now, but not all. I'm like, don't worry about taking that fifth year. Like, slow down. When you're in it, it feel like everything has to be rushed. And when you look back on, when you're 20-year-old in college, it seems like forever ago. And another year, what was that? That meant nothing. So
Yeah.
if you decide at some point, oh, you know what, I'd rather do this, maybe this is the better fit for me. I need another year or two to get the classes or the qualifications to apply for that job or to apply for that grad training. Just do it because
Yeah.
you're going to find out later on it was not, it wasn't such a setback after all.
Totally, that it can be as simple as, like what you said, it's like, okay, look at the things around you that are of interest to you
Hmm.
and go for it. Try something, like just keep
Yeah.
trying. And like the first thing you try might not work. It might not be a match, but you'll learn something from that. And there will
Hmm.
be takeaways that you're going to carry into the next opportunity. And it
Totally.
definitely is not. I mean, for the hundreds of people we've had on this podcast now,
Hmm.
I mean, probably a handful of people kind of knew the career they wanted to do early on and just kept pursuing it. It's really, really, really the minority of people.
Yeah.
Most people, and honestly, the on the other side, the through line has been that the most successful women on our podcast are people that have taken something that was like a draw to them when they were little, a little quality. It didn't even have to be a talent or a specific thing that they were doing all the time, a hobby or something. It was just a trait. Like you mentioned, you're like, even as a kid, like somebody got hurt and I wanted to get in there and see what was going on. And it's funny because you mentioned you're like, I don't know if maybe everyone's like this. I'm like, definitely not. Like I'm the kid, and so is one of my daughters. She's like, ick, sees like a cut and it's like, get it away from me. But my college roommate is a physician now, and I remember, I don't know, somebody fell at a frat party or something. And I remember she brought them back to our dorm room and she was literally like in there cleaning it with alcohol and doing all this stuff. And I'm like, and she wants to be a doctor. There are these certain things that make us uniquely us. And when you can kind of just plug that into the direction that you're going to go and find the match for that Eunice, it's tends from our perspective, it leads to the most success and passion in what people are doing.
Yeah,
I'd love to
absolutely.
go back to like your childhood years as early as you can remember. Can you paint us the picture of your family life? Did you have siblings? Where did you grow up? And what were you like as a little girl?
Sure. Well, I grew up born in New York City. My parents were living in New York. My father was training as a cardiologist when I was born. I have an older brother. He's 3 years older, and a younger sister who's 2 years younger. We moved to California originally when I was a few weeks old. They went back to New York. So I have some toddler memories of living in New York City, and then my parents ended up deciding to go back to my dad was did his fellowship at Stanford, and that's where we grew up, in Palo Alto, California, Northern California, in the Bay Area.
Mm.
um and gosh, what can I say? I had a great I was fortunate to have a great bringing up. I had supportive parents. I have come from a very tough but supportive, very tough and critical but supportive mother, and a father who only ever yelled if someone got hurt, and just like the most loving, caring person ever. So I had this very nice contrast to survive the wrath of my mother and the calm patience of my father. And I don't know, what can I say? My sister and
Yeah.
I would battle sometimes, but I get along very well with both of them.
Right. I think that's like it's a thing. It's a sister thing where I'm like all of probably my best qualities, but also my like issues that come up in therapy kind of sourced from my relationship with my sister. You know,
Yeah,
like it's so
yeah,
bountiful in that way, and only people that have like a close sister relationship can kind of understand that, I feel like.
yeah, yeah,
But you're also a middle child. I'm a middle child too. Did you
yeah,
feel like, I mean, I feel like we get a bad rap, but do you feel like
yeah.
any of your traits kind of fall into that or are attributed to the fact that you were sort of in the middle of your sibling order?
Yes, well, I'm very pro middle child, as I'm sure you are too.
Yes.
Um, no, we're like the linkers, and we're social,
Yes.
and we like to, bring people together and all of that. And yes, we might be a little bit rebellious, and certainly that side has helped me along the way because I'm absolutely not. Well, I should say I am a thinker outside the box.
Hmm.
Um, and that has always been important. I mean, part of my journey to find my way to dermatology or to medicine had to, part of that required that ability to be like a little bit of a rebel and say, okay, I'm not going to do this anymore. I was at one university where I went to play basketball. I ended up having an injury, so I couldn't play. It kind of changed the course of my year there, and while I had great friends and it was a great school, I just was like, I'm going to be back in California. And I did all this stuff to end up transferring. I went to UCLA. All of these little, it's like the butterfly effect. All these little or big changes have such an impact on who you end up becoming. But my parents were like, "What are you doing? This is
Yeah.
crazy. Why would you leave? You have a good thing here." And I was just like, "Nope, this is what I'm doing." So that was like the optimism, the rebel to just say, "Hey, I'm not going to follow this straight path." That certainly helped along the way.
I love that. So relatable to me. I feel
Mhm,
like it kind of seems like it's contradictory because I do feel like that like connector. I also kind of am I feel like I'm more of a mediator when it comes to any kind of
mhm,
conflict. I
mhm.
feel like I really don't like to like pick a side and argue it out. I'm more of a like, why is this conversation happening in the first place? That's
Yeah,
interesting. Like, what do we have in common? You know, or like
yeah,
maybe there's a misunderstanding here. Let's fix the
mhm,
communication. I'm just very
yeah.
much like I like to just keep things
Oh, nice.
together. But then at the same time, like when it comes to personal decisions, curiosities, I don't really feel, I never felt that like eldest daughter. You are an eldest daughter though, also in a middle child, but I never felt that
Mm,
like eldest daughter pressure to be perfect.
yeah,
I was like, I'm not going to be as perfect as my sister. So, I'm going to like, I'm just going to try things, you know? And when I get an
mhm,
idea, like I have to follow my idea
yeah,
and see what happens. Um, which is a blessing and a curse, but
yeah,
I
yeah,
think more of a blessing because there's just
yeah,
no regrets, you know?
yeah, definitely.
Uh, okay, so I mean, there's so many questions I have. You mentioned
Which, by the way,
basketball.
there's middle child, there's also second born, even if you are a middle. And I am seeing so clearly that
Same.
second born in my little 3-year-old who is complete. I mean, they fit the need, they should say they fit the firstborn. What is the word I'm looking for?
Yeah, like the birth
Stereotypes
order thing.
perfectly.
Yeah.
Yeah, the birth order. I've always loved birth order. One of
I
my
did
sociology
too.
classes was a lot about birth order, and it's very uncommon to find a family that doesn't, a set of siblings that don't follow that path of the firstborn being, the rule follower and the independent worker, and what have you, and then the secondborn be, carving out his or her niche and being generally sort of the rebel or the one that doesn't, friendly and social and fun, but also like couldn't give an SHIT if you say no to them.
You know,
As a
my
3-year-old, I'm not like that anymore.
but you see flashes. So,
Yeah.
for anyone that doesn't know, Dr. Blair has two gorgeous little boys. Your oldest is
Yeah.
how old now? He's
Just turned 5.
5. Oh, so just like ours. So 5 and 3, and I have 2
5
girls
and
that are
3.
5 and 3, and,
Yeah.
I've been joking with a couple of my friends that have their kids are at that same just turned
Mhm.
three-year-old moment, and I'm like, overnight, my three-year-old just became, like, a three-nager. She is I mean, she's already
Literally.
sassy and lovey, but now it's like the sass just, like, turns on, and then it turns off, and I'm like,
It is
oh,
overnight.
I cannot keep up.
Yeah.
Um but it's so fun because it's like I see little glimpses of what it's going to be like to manage her as a teenager, but I'm also like, oh, this is going to take her a really long way because she's just like magnetic, so fun
Yeah.
and so full of
Yeah.
life and so spunky that I'm like, all right,
Yeah.
this might be tough for me in about 10 years, but fun for the world.
Yeah.
I
I
love
love it.
it. Okay, so your second born, and you mentioned that you got into school playing basketball. So to be able to play sports in college means that you're playing at a certain level. Can you tell me when you started basketball and how that was a part of your life when you were young?
Sure. I've always loved sports. My dad was a basketball player. We always bonded over playing from the time I was a young age, and I was, um, generally athletic. So I was drawn to it and loved it. I played, every sport growing up. And then by high school, I was just talking to my husband about this. He's like, really, in California, soccer and basketball are the same sport, same season? And I was like, I guess, because I knew I had to pick one. I don't even remember these things. Um,
Well,
but
that makes sense. My family, I always thought about because it's like soccer is happening right now for the littles, and I'm like, I literally never ever played soccer. Wasn't in our family. I'm like, that would explain it because we were a basketball family.
yeah.
Just wanted
So
to say.
by high school, I had to choose one. I picked basketball because I
Mm-hmm.
just enjoyed it the most. And long story short, I ended up loved it, played well, transferred to a private school to play for this really fabulous coach I was so excited to play for. Tore my ACL right before the start of my junior season, and again a year later, right before the start of my senior season, and that took me out for both of those seasons. So career-ending injuries, basically, but I was determined to keep going. I actually had physical therapists tell me, no, you probably should stop playing. This is the kind of thing, if you keep going, you're gonna, with all the wear and tear, you'll end up having arthritis. I have two physical therapists literally said to me, if you keep playing, you may not be able to run around and play with your kids when you grow up. And I didn't care. I didn't care. Like basketball was my life back then. I was like, oh, whatever. I don't know,
It's also kind of feels a little middle childy because I,
yeah.
it's like someone's like, don't do that. You really should not do that. It's like my little
Mhm.
3-year-old turning back at me and like the interest is there, It's like, but why? But it's also interesting because I feel like in your teenage years and also like your early 20s, there isn't really, isn't really like you can't really fully be concerned with your future self. You know
Yeah.
what I mean? Like you feel
Mhm.
pressure when it comes to career and everything. But I remember like the lifestyle I was leading when I was modeling and kind of thinking about like, okay, this might like, impact my hormones later to be at like this level of thinness or whatever.
Yeah.
And it's
Yeah.
just like I don't care. Like this is what's
Yeah.
working for me right now and in
Yeah.
this lifestyle. And then of course later I was like, huh, it probably did, mess with my hormones a little bit. And that
Later down the road, yeah.
but it's like you just can't really think from that frame of
Yeah.
mind. And I don't think it's to the fault of young people either. It's just like that's our scope is what we're doing right then.
Yeah. I see that in my kids all the time too. It's so funny how you see these things in your kids. You're like, I know you think that, you try to give them the wisdom that you'll find out down the road. It's always funny.
Right.
In
Well,
any case, so yeah, but well, long story short, I ended up playing. I did go to play. It was like the top D3 team at the time, and they had good academic school. So it was Washington University in St. Louis. And
oh,
at my
amazing.
first practice, I tore. Oh, over the summer, I had torn some scar tissue, had some issues with that. Still wanted to play, really didn't see a life beyond it at that point. And I, I was after my first practice in college. I had a lot of pain that night. I like couldn't sleep from the pain in my knee, and that's when I
Ugh.
realized, all right, it's time. It's,
Oh
this is
man.
my body telling me really it is time to stop. So I ended up leaving the team, and like I said, that year kind of, a lot of things. It was also September 11th. So as a freshman, September 11th happened. I wasn't playing basketball. There was all these changes, and while I loved my friends, I knew I was getting a good education. I just felt like I wanted to be closer to home and come back. So after I finished a year, I ended up taking a leave of absence from school just to like figure this out. Am I going to get into another school that I want to go to and this and that? And it all ended up working out. But that was that path.
Oh, it must have felt like so overwhelming at the time, like this thing that
Yeah.
you've been building on for so long, and then you have these injuries and you keep pushing through the injuries.
Hmm.
like it's like, okay, if I fix my mind to that it's not going to be a thing, it's not going to be a thing. And then there's just certain
Hmm.
things in our lives where it's like your mindset can't win this thing, but then
Time
also
to
to have
give up.
something like September 11th, which I think could be comparable to what a lot of our youth have gone through with the pandemic timing and how that impacted their educations and their
Yeah.
social lives and their sports and everything. And it's kind of, just the things in our inner world, like an energy, like an injury, but then also in the outer world, like pandemics or national events and
Yeah.
these things that can kind of derail what our expectations are, and then what you do um, after that. Like, what are you doing
Yeah.
to pick up and keep moving?
Definitely. It takes
From
away a little bit of the innocence too.
totally
Sadly.
does. I
Sadly.
know,
Yeah.
and I think unfortunately most people by the time they get to their late 20s, early 30s can point to a couple things where it was like, okay, and then this thing happened that
Yeah.
was outside my plan.
Hmm. Yeah.
I don't know if
Definitely.
we've ever talked about the fact that you um transferred to UCLA. I
Hmm.
was at UCLA for undergrad also.
Oh no,
Uh
we probably
yeah,
overlapped, right?
gra-
What did you
I
graduate?
graduated in 2011.
Oh
This would
gosh,
have been
you're a baby. You're
2007, I think.
I was long gone by that time.
Well, you would think we overlap because your face is just glowing. I'm like, I
Oh
could never
yeah,
ask, like, I would never guess
right back
your
at ya.
age. So, um, uh, but that's fun. UCLA is just like an incredible school
Such a
for
good school.
medicine too. I
Yeah.
think it's really interesting how you, from an early age, you had this New York to California um, lifestyle, kind of getting used to both places. I mean, to grow up in New York City is, or to be born in New York City is like a very, very unique experience. And then being able
Mhm.
to come to California and like adapt to life here. And now, in your life, you practice there and here. Can you tell
Mhm.
us a little bit about just like the differences in the two cultures? What is you're drawn to in both spaces?
Yeah, I mean, as a kid, I was so young there, so my memories are like ice cream truck, like lightning bugs at
Yeah.
night, and like playing with grandparents. So
Yeah.
much different than now. But it's we just had this with we just recently last year moved our family out to New York City. So my sons had been in school from New York to Orange County. My
Hmm.
sons had been in school in New York City. We loved that they were getting that sort of very high culture, fast life experience, but really ultimately wanted them to have like the play outside every day, not worry about the weather, kind of all the goodness that comes from living in California. But we've gone through this of part of wanting them to still have that connection in New York City. So we get out there frequently. We want them to see their friends and do all the fun things that New York has to offer. But as far as raising a family there, you know, New York City is, in my opinion, New York City is great for certain periods in your life. So
Mm.
as a single out of college or training in medicine, certainly it's like the place to be. It's
You're going to see everything.
wonderful. So much pathology, patients from all walks of life. A lot of times, have just come from overseas and have never seen a doctor. So you're seeing all sorts of, training in dermatology. I was seeing all sorts of skin conditions that many residents only get to read about in textbooks. So that was so cool. It's such a great experience from the medical trainee standpoint, as far as like lifestyle, being young, going out, but no one's driving. You're able to, go out and have that fun life. Everything's open much later than California. It's a
Totally.
super fun place to be young and single, and then having children and dealing with a lot of crime, very close by, and certainly with COVID, living so close to others, and that was not the place to be during that time. It just starts to, we craved a different lifestyle for our children. So pros and
Absolutely.
cons, but
Yeah.
ultimately not the right one for me.
Yeah. Well, I'd love to hear about a couple things actually. You mentioned your basketball coach being this incredible coach. We always like to ask guests if there were people along their youth and teen years that really stood out to them or shaped the person that they became. Was that coach one of those people for you, or are there any other people during that time frame of your life that just you feel really impacted you?
Oh my gosh, so many. I mean, I can't even begin to say. Yes, the coach was Doc Shepler. I don't know if he's tuning in, but an incredible mentor, really a great leader, led with all the things that you want. He was um, wanted the best out of us, was tough in the best way, super brilliant mind for basketball, and just brought the team together. Always about teamwork and supporting your teammates and all the good stuff. Working hard, off season training. Really instilled a great. He's just a great leader, and he would build great leaders from within his team. So, so many great qualities that I learned from him, and then many of the people, when I look back on it, that have shaped my career are just derm mentors that
Mhm.
taught me so much and are just great caretakers, and the people that you would want taking care of you if um, you were in there, in that boat and needed someone, the great technical skills and also that incredible bedside manner that makes you feel like whatever serious skin condition or scary diagnosis you have, you're going to be okay in one way or the other because, they got you. So a lot of the same skills or qualities that were taught on the basketball court are the same sorts of things I was learning from mentors, whether it was my surgical internship or dermatology residency, or even outside beyond training, just learning from the docs I was working alongside.
I think you make such a good point about just that combination of skills that makes for a really good doctor, really of any type, but dermatology in your case, but then also for like someone that's a coach and working with people and inspiring people, or a manager in any capacity, to be able to have that skill, the knowledge that makes them an expert at what they're doing, but also that bedside manner and being able to communicate to your patient in their terms in a way that
Hmm.
gives them confidence. I think so many of us can, when you identify a really, really great doctor that you've worked with, there's always that combination of like, I trust this person's skill and decision making and experience, but then they also really make me feel like I'm in good hands.
Yep.
And it also when you have a doctor that maybe doesn't have that quality, and then it's like to be able to manage both of those things, and knowing for you, or like that part of that bedside manner maybe came from being a great player on a basketball team, or
Hmm.
being a middle child and able to kind
Hmm.
of be the communicator between your
Yeah.
siblings, and that all those little skills are picked up along life, and then you can plug
Yeah.
them into the place where you land in your
Yeah.
career.
So true.
So you've also mentioned that, your road to medicine wasn't linear. Can you tell us a little
Mm.
bit about that first job out of college, and then shifting gears and finding your way to where you're at now?
Well, and before even going there, so we didn't touch on it. So I was at Washington University in St. Louis for my freshman year of college, and
Yes.
then I had in my mind, excuse me, I wanted to come back to California, and I really wanted to go to, one of the top schools in California. I had friends, having grown up in California, a lot of my friends were dispersed in California schools,
Hmm.
and so I had the few that I was really interested in going to, UCLA being my top choice. But anyways, in order to transfer into the UC system, you actually have to be a junior. So I ended up taking courses at Foothill College. They have this honors program that you can apply
Hmm.
into, or they did at the time. I don't know what they have now. And funny enough, my mother today just sent me a link. She was like, "Hey, look, it's Foothill College, the number one community college in the country." It was just ranked. I didn't. This is why I was seeing patients, and obviously I came straight home and I to join you, so I didn't
Yeah.
open it up, but. I was like, yeah, I got a great education there. And she was like, I know you've always said that. Some of my best classes were at Foothill College. And I point this out to say, don't knock it. When I was in
Mhm.
high school, it was like, oh, you're going to community college. Okay. You don't have, that's because, it's not the goal. Right. But I think it was I tell people all the time. I think it's an incredible stepping stool. You save a ton of money. You can get a great education if it's a good program like this one was. Um, and and from there some you can get into really great schools because there's so many wonderful transfer programs, particularly like in a state funded school into a state university and so forth. So don't knock community college.
I can't tell you how many really successful people I know, my husband included, did that, exactly that. One of my best
Yeah,
friends from UCLA also did that and transferred as a junior. And when she told me that and I met her, I was like, I didn't even know you could do that. And when
yeah,
you get your transcript, when you graduate from UCLA, it doesn't say this person transferred from a community
yeah,
college. It says UCLA graduate.
yeah.
And I think it's such an encouraging thing to note because it's like there also, just because you're at a community college doesn't mean there aren't incredible courses and really useful education for you to just embrace in that setting. So,
And a
um,
lot of the intro
that's
courses are
such a great thing.
smaller. So
Yeah.
instead of being in like a 200, 300 student introductory course, you're in these like smaller, intimate classes. So I had a fabulous, what math was I in then? Oh gosh, I don't remember, but I had fabulous English class, really great Spanish classes. I don't even remember them all. Anyways, good stuff. And, to make my parents feel better, I had taken a leave of absence from Washington University. So if it all didn't work out, I could have just gone back, but it did. So that's that. You
Very
were asking
smart.
about jobs out of college.
Yeah.
So what did I do? After college, I felt like I wanted to do something in, oh gosh, this is like, what is it? As an undergrad, you could get credits. I was a communications major, so I was a mass
Hmm.
communications major. You could get credit for school by doing an internship, and I loved the idea of that. I'd always loved working. I had all these odd jobs growing up. Um, I mean, when I was a kid, I liked like doing a lemonade stand or selling cookies or doing anything. I always loved the idea of like making money from a young age, but not just because of that, but just like I loved the idea of selling things. I would
Yeah.
do,
Which, like,
a lot of my games were the same.
I'm hearing that too. And it's like, and now you have a skincare line and you have
Yeah,
that, like, that's like such an entrepreneurial thing. Like the kids
yeah.
that are like, I want to sell my Girl Scout cookies or I'm going to make a lemonade stand or
Girl
like,
Scout cookies,
you
loved it.
know,
Yeah,
sell people's used clothes or whatever. I'm like, there are these little signs of like that person might be an entrepreneur in some capacity later.
yeah.
And
That's so
just to see what
funny.
you're doing now, it's awesome.
That's so funny. So, in any case, so yeah, I had like worked at the body shop. I worked, it was skincare. What are all the little things I did? Well, anyways, we'll talk about after college. So I thought I wanted to work there were fields that interested me. It was like the entertainment, in UCLA, living in LA, going to work for one of the networks, or I also thought about working in like events or event planning, some of these fun career fields, and I ended up randomly. I used to back in the day. I would study at the Peninsula Hotel. This is being in college
Fabulous.
in Westwood, Beverly Hills.
Totally.
You could, I don't know if I should even say this out loud. I don't think they're going to come for me, but you could like go sit by the pool and study. And like, how fun
Yeah.
is that on a weekday when there's nobody there? Um, Randomly met somebody there that was like waiting to see his friend, yada, yada. Long story short, he's like, oh, you're looking for an internship? I don't know how this comes up, right? It came up that I was a student, whatever, whatever. He links me with his friend who is from the Annenberg family, and he was running a yoga wear company. This is before Lululemon. It was called Energy. And this is so funny. Like all these things, like I don't even think they're not even in the front of, I don't even think about anymore. But
Yeah.
long story short, he offers me this internship. It was a paid internship. So I was like, oh, I'm getting
Yeah, he
paid.
loves
I'm
it.
getting credit. This
I'm
couldn't
getting
be
yoga
better.
clothes.
Yeah, I get yoga clothes. And and then I met a really great friend working there, and that was super fun. So out of college, the first thing I did was I decided I was gonna have a clothing line. So it was like basically what Skims is now. I didn't have any Kardashian backing or fame to make it that, but that's what I did. So I had learned, I'd met this great dye house, pattern maker. I knew where to buy the
Wow.
fabrics because I had been running. This was a very small. It was like two or three of us running this small yoga company, so I knew where to go and what to do, and that's what I decided to do. It was so fun. I was living in Palo Alto. I was back living with my parents, and all of the and create and producing products in Southern California. So almost every week I was going back and forth. I was dating someone that lives in Southern California, not living with him, but just like back and forth doing this crazy thing. I was on the road. This was 6 months after college, and I really loved it. It was so fun to create and design and have my things made into something. Went to Beverly Hills, got all these orders from these great stores. I was so excited. I was selling to yoga companies in Mill Valley, and then I needed, and my parents had agreed to give me $5,000 to run this business, and I had gotten to the point where I had run out of the $5,000, but I had all my samples. I was ready to produce, and I wanted to fill these orders, and I needed money to manufacture the products to fill the orders. And they were not into what I was doing. And I was home one weekend, and it was a lot because it was taxing to be traveling back and forth all those hours on the road. Long story short, my mom had like gone on whatever site, this is many years ago now, gone on whatever site to look up jobs for me, had found one that was, it was a financial management company in Palo Alto, um,
Mm-hmm.
owned by one of my high school at this school, Pinewood School, high school basketball teammates' father, and they were looking for someone to like be an office manager and move money basically. And it was a salaried position, and I think I was like sleeping. I woke up late that day. My mom comes in. She's like, "Hey, I found this job. You got to apply." So I did. Long story short, I take that job. I knew there was no more money. They weren't willing to help me out with this, with the line anymore. And I was kind of bummed by that, but also probably like kind of relieved that, okay, I'm going to have like my own money. It's going to
Yeah.
be good. And so I completely pivoted. And then I was working for this financial management company for about 6 months. And my mother, again, um, knew that it wasn't the field for me. And long story short, she was like, "Hey, there's these post-baccalaureate pre-medical programs." She knew over the years that I had always had like a in the back of my mind, oh, maybe medical school, maybe become a doctor, and just kind of had gone in a different pathway. And she said, what do you think?" And I was like, okay. At the time, there were only 12. I think there are now many, many of these where you can, for
Mm-hmm.
someone who wants to go to medical school, didn't meet the requirements or take all the sciences and so forth to apply to medical school, you can go. My program was 2 years. You take all the sciences and meet and all the requirements that you need to apply to medical school, and then you can apply. So here I was
Wow. I really
again,
didn't
big
even know that
pivot.
existed.
Yeah,
That's
and I
amazing.
remember literally where I was sitting when she told me this, and I was like, okay, here we go. And I applied, and I always say, had I known what it was going to take to become a physician while I was sitting at that desk getting that information, there's no way I would have done it. But there's no way to know that, right? You got to just get
Yeah.
into it. And so, don't psych yourself out. If you have an idea for it, kind of roll with it and follow your instincts. That's a big thing. I would always want to leave someone with is, which is what I've done a lot in my life. And sometimes your instincts will get you into trouble, but for the most part, hopefully they will guide you, steer you in the right direction. And so I did that. I applied, we got into this program, and I went and did 2 years at USC, big time trader, UCLA to USC.
Same. I did that for
And
business school. So
yeah, okay.
classic middle child, like I can
Yeah.
do both.
Like I can be friends with everyone in LA.
Right?
I can relate.
100%.
Um, and such a fun 2 years. And then applied to medical school, and the rest was history.
I literally didn't even know about that kind of
Yeah,
program, but I guess it makes sense
yeah,
because we all know, a couple people that have like become doctors later in life.
yeah.
And I think it was a really good point that you also made about like if I were to look back and see like how many years this would take to do this thing, I don't know if I would have done it.
Hmm.
That it like that's a reflection, but it's also like thank God you didn't, like thank
Yeah,
God you didn't
yeah,
have that kind of hindsight too early because
yeah.
there's so many like Kashia and I talk about this with having a podcast. Like if we literally knew how much work it would take and just constant, like the back end stuff and figuring
Yeah.
out, I don't know if we would have been like, I don't have the time. I'm not gonna be able to
Yeah.
do that. Then you're
Yeah.
you're working incrementally. You're like, okay, this is a 2-year program. Okay, and then I'm gonna apply for this thing, and then I'm gonna get into med school, and then I'm gonna do, all
Hmm.
the different things that it takes to
Yeah.
be at your level and have all the accreditations
Yeah.
that you have now. And it's kind of like a blessing in disguise that we don't have that
Yeah.
sight
And then you
into
look back on it. I
the
mean, I guess
future.
it's like,
Yeah,
childbirth. Like then you forget about it. But no,
oh,
I
totally.
know what it was, but I don't remember the pain of it. But like sleepless nights, so many sacrifices, missing out on family trips and all the things. But it's for a reason, and you
Yeah.
follow your path, and I wouldn't change anything for the world. And I like that circuitous path because it's so important to find what you love and what you want to do, and it's also important to find what you don't want to do, and like
Absolutely.
dating, it's good to have, experienced what didn't work so you know what does work for you and all that.
Sometimes I think those lessons are more accessible and sometimes even more powerful than the like
Mhm.
what's right for me. Like we
Yeah.
get moments in life where it's like, oh yeah, this feels right. Oh yeah, this feels right.
Yeah.
But they're a little bit, they're like glimmers. They're harder to grasp and really know. But like when we get those things like, nope, won't do that again, or like that's not for me. Like
Yeah.
you really don't, those are very clear lessons that we get.
Yeah.
And they can be left and right. The more you're trying things, the more you're gonna have those like bumper rails, I like to think of them as in our life stories. If you could tell a young person who's, looking at careers, thinking about dermatology, has an interest in it, if you could give them any piece of advice in pursuing a career in dermatology, what would it be?
Oh gosh. Well, part of it is don't be intimidated by it because so many, even I've met so many prospective medical students, prospective derm residents, and even the most qualified are nervous about it because it's tough to get into medical school, it's tough to get through the years of training, it's tough to get into derm residency. And that's where my optimism helps, where it's like you just put the blinders on, just believe it's going to happen if you work hard and try and make good connections. Like I know that it would have been one of the, so if you are in medical school and you want to get into dermatology residency, which is very competitive, do meet people and get into, research is big, but get into the field, really get your experience it, make sure to experience it to make sure you really want to do it. Like it's not just the idea of it. Make sure that you are passionate about it and then make those connections because those are the people that are going to help you get there, whether it's a letter of recommendation or whether it's because they know a friend, there's a spot that opened up or, what have you. So networking is so important in all fields for the most part, but certainly in medicine. And just like stay optimistic. If it's what you want to do, even if you don't match the first time, just stick with it because when there's a will, there's a way.
Absolutely. Well, we always like to end our episodes with the same question, and we ask our guests, what is one quality or trait that you had when you were a teenager that you maybe didn't appreciate then, but you love now that you can look back on it?
Oh my gosh, this is a good question. Woo! Trait that I didn't love.
Or maybe you didn't even acknowledge.
I mean, I've touched on it. I'd love to come up with something different, but it's probably is that optimism because you can, like I said, my mother, she's wonderful in so many ways, but she is very critical, hypercritical, and very opinionated. And my optimism is not, she's very practical. I'm the opposite. And so maybe it's optimism, but maybe it's this, what's the opposite of practical? Sort of a dreamer.
Uh-huh.
And I guess that has helped me get to the place that I am now in terms of like, oh, I can start a skincare brand. Like, oh, I can be a dermatologist if that's what I want to be, even though that's not at all what I just trained, went to school for. And I would say that's the quality.
I love that. And I
Yeah.
think it's taking you a
So
long way.
yeah, and in terms of like how did you feel about it back then, it would be like, well, I got criticism for it, in one
Yeah.
way or not, maybe not direct criticism, but choices that I was making were deemed as mistakes in some capacity. And now it's that same quality that's like, well, that's gotten to me where I am, and I'm happy doing what I'm doing, and I'm passionate and I love it. So I guess that would be the thing.
I love that. I think it's so relatable. I think that I have like a similar dreamer type where it's
Mhm.
like it's kind of like I need to express the idea first and then like kind of the how to comes later and it's a little bit
Yeah,
less
yeah,
central,
yeah.
for better or for worse. It's like find people around you that are really good at executing things.
Hmm.
um
Yeah,
but I
definitely.
think I just as a young person, I kinda always thought of it as like, "Oh, I'm kind of a black sheep," and that it's like
Hmm.
I get these ideas and stuff, and it's not always like what people are telling me to do, but I have to kinda like work them out for myself. And now I'm like, I love the idea of being a black sheep. I love having
Hmm.
like sharing that I'm like, I'm vulnerable enough to try things, and when I fail or they go great, like I'm gonna share what I learned, you know? And it's like
I love
life is
that.
full of failure, and that's so cool. Like the black sheep stands out in the herd, you know?
Yeah,
Um,
that's so true.
so I think
Yeah,
that's
the
so
oh
cool. Yeah.
Blair, from my
Right?
family or my friends
Eye
or my
roll.
siblings. Now it's like,
Totally,
well, oh Blair.
totally. They're like, "Did you see Blair's write-up in Real Self magazine or all of the different, publications and stuff?" It's a nice full circle moment. Well, this was
Yeah.
such a treat. I
Yeah.
was thrilled to have you on.
Thank
Please,
you.
everybody, go check out Skincare Junkie. Go to Nordstrom and buy a bunch of it because it is literally coming from a skincare junkie and the queen of skincare herself. It's a product that really, really works. And
Yeah.
where can people find you if they want to see you in person as a derm or online? Where can they find you?
So most of my days are spent in Orange County and Newport Beach. I'm at the new California Skin Institute, recently purchased by Schweiger Dermatology. So Schweiger Dermatology in Newport Beach. I also on Fridays practice at the Newport Beach Dermatology and Plastic Surgery office in San Juan Capistrano. And then from time to time, I'm practicing in New York City, still seeing patients there.
We love it. Well, we'll link all of those sites in our bio so people can find you. And thank you so much again, Dr.
Thank
Blair. You
you. This
are
was so
amazing.
fun.
It was a treat. Talk
Thank
soon.
you. Bye.
And that's our show. If you liked what you heard today, please like, subscribe to, follow, and share Meet Bridget with your circle. The best way to help our work here is to rate and review our podcast. We're listening and constantly working to build something helpful for you. Catch you next time.